Thank you very much. Now we're going to have some closing statements from our candidates. You each have 2 minutes. In your closing statement, we ask that you share with us what you consider to be your single greatest accomplishment for the human services sector during your tenure in public service or in your professional career. Candidate Baker will go first, but following their closing statements, I'm going to offer some of my own remarks and ask that you hold your applause until the formal conclusion of the program.
So I don't get to give my closing statement that I came with?
No, I have my own closing statement.
So you want my closing statement
Yes,
to be what I consider my greatest accomplishment?
Your greatest accomplishment for the human services sector during your tenure in public service or in your professional career.
Well, I guess I would say that, first of all, I'm not a big believer in sort of greatest accomplishments, so let's just forget about that. And what I'll choose to say instead
How
is...
about most meaningful?
That works. I like that. I spent 4 years, as many of you know, working as Undersecretary and Secretary of Health and Human Services, and I had a chance to work with many of the people that are in this room on some really difficult, complicated issues. One of them was the most significant facility consolidation project that's ever been undertaken by the Commonwealth of Massachusetts to close some very expensive and isolating and not particularly effective institutions and to move care either into more effective institutions and more appropriate institutions or into the community. I consider that to be in many ways one of the most meaningful opportunities I've ever had to work with this community. We also put a whole series of very significant programming in place to dramatically alter the way the Medicaid program related to a lot of the community-based care that you folks provide so that we could create the capacity for the state of Massachusetts to access on a sustainable basis federal reimbursement for a lot of the work that was being done. I also found the work we did, especially around increasing and enhancing our adoption capabilities, to be very meaningful. I had a chance to meet a lot of kids and a lot of parents who benefited from the fact that we took that adoption process and cut it in half for many of the kids who are waiting to be adopted in Massachusetts. And I would just close by saying I have found practically every encounter I've had with the health and human service community to be, especially this community, to be one that I have found to be meaningful and important and amazing in many ways. And it bothers me in some respects that you have to operate under a system and in an environment that is so profoundly complex that in many cases it works against your capacity to do what makes the most sense for the people you're trying to serve. And if I get elected governor, I will do everything in my power to fix that.
Thank you. Tim Cahill.
Thank you. And thank you very much for the opportunity to be here, Karen, again to Michael and to the Providers Council. As treasurer, you don't get a lot of opportunity to interact with providers, with this council, and with the human services industry. But the one area that we have had, I think, some impact, some others will judge it whether it's great or minor, is with the Mass Council on Compulsive Gambling. As many of you know, I oversee the state lottery. And our job is to maximize revenues, to bring money back to cities and towns. We've done it better than anyone. But we also understand, I understand, that there's a cost associated with that. So when the legislature, because they were forced to cut back on the commission, we stepped up. The lottery stepped up. I stepped up to make sure that Kathy Scanlon and her group was given a portion of our advertising revenue, of the commitment that the legislature gave us so that they could continue their mission, so they could grow their mission. It was an unlikely duo, Kathy Scanlon and I. At least I thought so when I first met her, because I thought she'd be at one side of the table and I'd be at the other side. But I found common ground with her and her council and her association. We put commercials together where we both started, although she started much more than I did. And it was a fruitful and eventful process for me, because I had to, and I did look at the other side of what gambling costs people, what the cost to society is. And I've never been blind to it, but it was a very important part of my maturity as state treasurer and my growth. And I promised to bring that compassion and an understanding to the governor's office, to understand that there are always two sides of every issue. And it's not always mathematical, and it's not always money. It's about trying to do the best you can with what you have, trying to succeed on both levels, providing money for local cities and towns, and helping those people who've been hurt by what we sometimes do in government. And that's my commitment to all of you here. that we will continue to work to solve the problems of this Commonwealth despite any challenges we might face.
Thank you. Patrick?
Karen, thank you. Michael, thank you. And to the Providers Council, and again, thanks everyone for participating today. And thanks especially to those who were willing to go on camera and offer your questions and comments and insights. I've worked closely with a lot of you in this room. I've visited your facilities. I've met your staff. I've sat down and had conversations with the people you serve. They've come to my office, sometimes invited, sometimes because it was time to sit in. And I have not rushed past you once. I have stopped and sat and listened. I have held hands, and I have gone to work. And I don't grandstand like governors apparently are supposed to do. But you know, like I do, that I have fought for the funding to support what you do because I respect what you do and how you do it. A lot of the complexity that you have helped me see is complexity that's been in the system for a long time, some of it created by a candidate in this race. It needs to be fixed. But it's not going to be fixed with the wave of a wand. It's not going to be fixed by me acting like I'm smarter than you. It's going to be fixed because we sit together in the same spirit that I've sat with your clients and held their hands when they were worried about cuts in state budget during a time of fiscal crisis, and decided that we were going to see each other as human beings. The balance that I have to strike as governor, and the way I must, because I see government as helping people, helping you meet their needs. If that's the kind of partnership that means something to you, a partnership of candor and respect, a partnership of true and effective advocacy, a partnership with someone who understands that government is about helping people help themselves, just like you do, then I'm your candidate, and I'm asking for your support. Thank you very much.
Thank you. Jill Stein, please go to the applause. Jill Stein, your closing statement, please.
Yeah, I would, as a medical doctor serving patients for about 25 years, I've certainly had the honor of working with many adults largely, but also young adults with a whole variety of disabilities. And have greatest respect and concern for their welfare and respect for what they bring to our, not only our societies and our work environments, but to our political process and our sense of community. And I really want to commend everyone in this room and the Providers Council for bringing your voices into the race, which is so important and I think brings us back to what our values really are as a community. So I thank you for that. But in my work in the world of healthcare, I myself witnessed a very perplexing rise in disabilities, certainly much more so than what our generation grew up with among our children. And I began to work then reviewing the scientific literature, was a co-author on a major report entitled Toxic Threats to Child Development that looked at what are some of the preventable causes of disability. How can we do a better job of caring for those who have disabilities now, minimizing their progression, and also preventing them from happening in the first place. But I do have to say that at the end of the day, I think what really counts are results. And it's really important to look at where we are and whether we want oratory and beautiful sentiments from our leadership or whether we want results. And as someone who has been a watchdog in state government, I would add that what I said before, we can do much better. When you're told there's not enough money, it's for you. The money is there in my administration.
Thank you. Thank you very much, Jill. Now, ladies and gentlemen, please join me in giving a round of applause.